have very eminent panelists here today. The topic is what I could not ask my doctor, the question. Now, when we see these kids, I somehow feel that maybe their parents would have asked some right questions when they met the doctors first time. There could have been some questions unanswered that probably are still lingering in their minds. Why does it happen? Maybe they're feeling shy. Maybe they're feeling the question is not right. It's a very minor question. Should I ask? Should I not ask? So there is a lot of confusion, probably going through the kids who have grown up to be teenagers, who have undergone so many surgeries and other cleft intervention. But it's a start. We have to ask questions. So as we know, we have really cleft professionals over here. Our consultants are here. Our surgeon is here. Our speech pathologist here. We have orthodontist amongst us. And we have 3 cleft warriors. Ashim is there, Sakshi is there, and Parakravi is here. So for this Jugalbandi, I will leave it to them because they have undergone so much. From first surgery to probably multiple surgeries, multiple speech sessions, multiple orthodontic sessions. So from you all, because Ashim and Sakshi represent Surat also. So within the community, what they have done is they have collected questions on behalf of everyone over here. And yes, I think so the first question probably is from Sakshi to Dr. Altaf. So Sakshi, please go ahead.
Thank you so much, ma'am. I feel really grateful to be here. My first question for Dr. Syed Altaf Hussain sir is that I have already undergone 8 surgeries, and this has been a very painful journey. But I want to know that after the age of 21, will I still need more elective surgeries, and is there a limit to the surgeries that I may require? And when does it become too many surgeries? This has been a very overwhelming question from a lot of left warriors from our community. So yes, can you please answer, sir?
Okay. Well, she's asked me a question about how many surgeries do people need. I'll make it a little more general because, see, I cannot speak about her, though I'm the first time I'm meeting her. So I'm not going to discuss about her, but I'll take the question as a generic question. So how many operations will a child born with cleft lip and palate need? Ideally, lip repair. We do it at 6 months. Somebody may do it later or earlier. We do the palate at 1 year. Then we follow up every year. Then we bridge the gap in the teeth. Alveolar bone grafting at about 7 to 9, 10 years, depending on the child. And full stop. That is the ideal situation. This is what a child should have. A child born with a cleft. But we do not live in an ideal world. There are several treatment protocols which try to idealize the outcome. The problem is, even if these operations are perfectly done, if they are not done at the right time, and if they're not done using a certain technique, then they need additional surgeries. If there's a problem with speech, then we may need something to correct that. That ideally is done. If this is the ideal world when the child comes to you at birth. If there's a problem with the speech, it's best corrected as soon as you can diagnose the structural problem in it. About 4 or 5 years of age, when the child will allow an nasoendoscopy or a video fluoroscopy. Mid-phase, our present protocols hopefully will minimize the need for moving the mid-face. See, the mid-face in a cleft is not because of the cleft, it's because of the operation more. Their faces, the mid-face doesn't grow at times. So we correct that somewhere between 11 years and at the end of growth, 18 years. And then there might be a need for touch-up of the lip or nose or both, depending on the child. And for somebody who has had multiple operations, uh, you will need, if it is correctable, I think you should correct it. We are able to rehabilitate even children with, sometimes they have not had the ideal kind of treatment. Even them we can rehabilitate. The number doesn't matter. The quality and the timing and the way the operations are structured, and you time it in such a way that there is minimum disruption to normal living. So if these are balanced, then no number of surgeries are too many. I mean, you can't say anything is too much.
So, and then the thing is that we have to go through multiple surgeries, right? And after it gets so exhausting that, you're like, okay, now let's stop. Even if it's not perfect, then let's just stop right there. And that is where the question is coming from there. That, okay, how much is too much? And at what stage will I look completely perfect or like someone else? Or when should I just stop and just accept myself? That's how it is.
It depends on you. If the child says doesn't want a surgery, I wouldn't operate.
Yeah, and to that, I think so Dr. Altaf also said it's you who you have to decide, because if the patient is saying, no, enough is enough, I don't want multiple surgeries, I'm very happy with what I am. So that will definitely take care of it.
Thank you so much.
Yeah.
Yes. So thank you, Renu, for this and for mentioning that all of our questions have come from a lot of other cleft warriors. We asked a lot of people in our community on Instagram, WhatsApp, and these are the questions that we've gathered from them. If there's one question that was asked the most, it is this. And I'll ask this to you, Dr. Altaf. Now, I am someone who's born with a cleft lip and palate. And I have just heard a story of a cleft warrior who I met in Agartala. She had a cleft lip, her sister has a cleft, her mother has a cleft, and her grandfather also has a cleft. Now that got me thinking, Dr. Altaf, what are the chances, like if I have a child in the future, right? And that's a question coming up quite often. What are the chances, right? And what factors go into it? And based on that, what can I do, let's say as a potential future father, to take precautions or mitigate the risk?
Well, that's a very difficult question to answer. Anybody who has a child runs a risk of having a orofacial cleft lip and palate. The random incidence is it ranges from 1 in 600 live births to 1 in 800 or 1 in 1,000 live births. So anybody runs a risk of having a baby with a cleft. Having said that, if you have a cleft in the family, the risk goes higher. It's been variously, and if you have, if your father or mother have a cleft, this we are talking about cleft lip and palate. Palate alone is different. We'll just talk about cleft lip and palate. Sometimes it's only cleft, sometimes lip and palate. If one parent has, the chances become much higher, 1 in 4, 1 in 8. And if both have, even higher. But there is a chance of them having no cleft as well. And then if you have an ancestor, grandfather or uncle, again, there is a higher risk than the normal population. Having said that, you can only, it's like taking a chance. See, you are likely to have a cleft, but if the child has a cleft, if you have a cleft, then it's 100% for you. And just somebody with a cleft, even somebody without a cleft, the only way to completely insulate yourself from not having a cleft is not to have a baby.
No, but thank you, Dr. Altaf, and thank you for this question. I think so when we had that panel of companions, it was rightly answered. The mother was saying, I was not worried. So awareness, education, I think so. Yes, that doubt will remain in your mind, but more you educate yourself, Uh, and you were giving the example of Agartala. I would give you a story of Agartala. This was years ago, probably my first or second visit with Smile Train to a partner hospital in Agartala. And there I met this surgeon, Dr. Seema Rekha, and she introduced me to two young children who met in the ward. And they fell in love after surgery. And their first question to Dr. Seema Rekha was this only: what if? We are wanting to get married, what if we also have a cleft child? And then they said, we have live example, my life has changed, my husband's life has changed, so what? Smile Train is there to guide, to take us forward. So I would now ask Parkavi to, I think so she has a question for Dr. Badri.
Now I am going to ask about dental care. Will I always need special dental care, and how will that impact my daily life?
That's a very good question, and the best answer I can give you is you don't need a dental care if you can take care of yourself. As long as you brush your teeth regularly, as long as you keep your teeth clean and follow dentist advice in prevention, you are no different to anybody else. The dental care has to start as soon as after birth. You slowly start massaging your gums as soon as the baby is born, and then slowly, when the teeth erupt, you brush really well. The problem of decay and dental issues arise when you don't take care of your teeth. Children with cleft and the parents taking care of them, or caretakers, have a lot of commitment and issues with so many different aspects of their life and family. And in this process, they fail to take care of basic things like brushing and keeping their teeth clean. If that can be done, then there is absolutely no need for any special care dentist to help out in terms of treatment. So prevention is first. You may want to go to the dentist to make sure you understand how to prevent these things happening, how to keep your teeth clean, and how to avoid decay. This is no different to the normal babies without cleft. So the answer is you don't need special care if you can take care of yourself. But if you do go and visit any dentist, you don't necessarily need to have someone who's got a special expertise in cleft. Anybody can treat caries and decay.
Next question is for you. Dr. Badri, I want to know, also a lot of people from our community wants to know that they are undergoing orthodontic treatment. Some may have temporary implants and temporary teeth. I have braces now, right? So, but it also causes problem while eating. Also, personally, I have felt that now that I've gotten my braces, there has been some more difficulty that I'm facing while speaking. Oh, yes, when I was not having braces. That is one thing. Other than that, we face problem while eating, maintaining the hygiene of our dental, oral care. And are there any other long-term solutions except for temporary implants or temporary teeth? And what is the best solution for teeth alignment and overall oral hygiene?
The answer to this question is more like a holistic approach for dental care. There are different specialities that take care of your teeth. Orthodontist does the braces to straighten your teeth. Dentist take care of decays and normal activities. And implantologist or surgeons put implants in, and prosthodontist replace missing teeth. So the entire group of clinicians will give you treatment for over a period of time. Having said that, the answer to your question has to come from a joint approach between all these four specialties and the patient to decide what is best for them. In certain instances, if there is a gap, the orthodontist can move teeth to close the gap and give you with no further dental treatment in the future. In certain instances, the orthodontist has to work together with the specialist replacing missing teeth to say, I can't close the gap, I will open the gap, but can you do a replacement with an implant or another type of false teeth? Every patient, every children is different. It also depends on how the growth happens of the jaw. If the growth of the jaw happens in a normal way, then it's much easier for us to give you treatment without replacing. But if the growth of the jaws are not as expected, then we may have to do some additional work. In terms of treatment, our technology advancement is so exceptionally improved now, you don't have to worry about anything, right? If you want to replace, it can all be done in a day. They can put an implant in a day, 3 months down the line, they can put a false teeth in. So whatever the problem is, there is a very good aspect of treatment that can last for years and years without any further dental maintenance or care. Usually we find where there is a defect in the face, that is the cleft, there is missing teeth, and 50% or more of our patients will need some kind of replacement. We usually say implants, which is a long-lasting one, which is much more, has got much higher longevity. But there is nothing to worry about implants. Smile Train can support, and if patients can get implants and a false teeth in, it will be no less aesthetic than anyone with a beautiful natural smile. End of the day, we can bring you into a Hollywood smile, whether you have an implant or a false teeth or a removable teeth. That level of aesthetics we can bring with any type of treatment. With regards to braces, braces is something more like an adjunct for surgery. So we do short course of braces before surgery. Usual pattern is, like Dr. Altaf said, they have surgery at 10 months for bone graft. We do a short course of 6 to 9 months of braces just before the bone graft surgery. If they want jaw surgery, then there's a short course or a longer course of braces just before that movement of jaw. And there is a comprehensive brace treatment done between the age of 12 and 14, which happens for any child, whether they have cleft or not cleft, to make their teeth nice and straight, to bring back those Hollywood smile. I guess that answers your question.
Thank you so much, sir. It really answers the question really well. But sorry, just one more thing.
Please go ahead.
I think I have this fear that, okay, now that, okay, I'll make some implants or whatever, the each alignment. But what, right? Yeah. But what about when we grow old? So how easy or difficult it is to maintain oral care at that time with implants? Or how? Because I know that there is an expiration date for the implants, right?
Any dental treatment you do, whether you have implant or false teeth, any additional dental treatment you do, the guarantee is usually 10 years. The only difference is when you place an implant, it can stay much longer. Implants been in the market only, in the world market only for 30, 40 years. So for that time, we have evidence that it can last for 30, 40 years. We don't know after that because implants have not been there for much longer. Usually we say implants can last for 30, 40 years, but you have a cap on top of implant to replace the missing teeth. Implant is more like the root of your teeth, but you have a cap. The cap, the guarantee is 10 to 15 years, and then you replace the cap every 10 years. So in terms of dental work, the summary is any dental work done needs a replacement every 10 years.
Thank you so much, sir.
So, Parkavi, you have a question for Dr. Savita?
Yes, ma'am. Often I think I am speaking clearly, but strangers may hear nasal tone. What can I and other cleft warrior do to reduce this nasality? Should we avoid using certain words, ma'am? Ma'am, can you please do Tamil, ma'am?
Sure. Thank you for that question, Parkavi. So, Parkaviyoda question என்னன்னா, நான் என்னோட ஸ்பீச் நல்லா இருக்குது, என்னோட ஸ்பீச் கிளியராக இருக்குது. ஆனால் அப்படி இருந்தும் நான் ஒரு சில புது நபர்களிடம் பேசும்போது, அதாவது ஸ்ட்ரேஞ்சர்ஸ் கிட்ட பேசும்போது என்னோட ஸ்பீச்சில் கொஞ்சம் நேசாலிட்டி அவங்க பெர்சீவ் பண்ணுற மாதிரி இருக்கலாம். ஸோ அப்படி இருக்கும்போது நான் என்ன பண்ணணும் அப்படிங்கிறது தான் கேட்குறாங்க. ஸோ நீங்களே இப்போ சொல்கிறீங்க ஸ்பீச் கிளியராக இருக்குது அப்படின்னு. ஸோ ஸ்பீச் கிளியராக இருக்குங்கும்போது அதில் வந்து எந்த விதமான எரர்ஸ் இல்லை, கிளெஃப்ட்டுக்குன்னு உண்டான எரர்ஸ் எல்லாம் இல்லை அப்படின்னு நான் அசியூம் பண்ணிக்க போகிறேன் இப்போது. ஸோ ஸ்ட்ரேஞ்சர்ஸ் கிட்ட பேசும்போது நம்மளோட இந்த நேசாலிட்டி பர்செப்ஷன் எப்படி ரெடியூஸ் பண்ணணும், ஸ்ட்ரக்சரல் ப்ராப்ளம்ஸ் இல்லை, என்னோட ஸ்பெசிஃபிக் ஸ்பீச் எரர்ஸ் எல்லாம் கரெக்ட் பண்ணியாச்சு அப்படின்னா பொதுவாக நம்ம ஞாபகம் வச்சுக்க வேண்டியது 2 விஷயங்கள் இருக்குது. ஒன்று, ஒரு சில நேரத்தில் பல பேருக்கு என்ன ஆகும்னா தன்னை அறியாமல் ரொம்ப வாயை திறக்காமல் கிளென்ச் பண்ணி பேசுகிற பழக்கம் இருக்கும். பல்ல கடிச்சிக்கிட்டே பேசுகிற மாதிரி இது பண்ணுற ஒரு பழக்கம் இருக்கும். அது சம்டைம்ஸ் உங்களுக்கு அறியாமல் உங்களுக்கு அது வந்து பழகி போன ஒரு விஷயமா இருக்கும். ஸோ ஃபர்ஸ்ட் ஓப்பன் மவுத் அப்ரோச் அப்படின்னு சொல்லுவோம். நல்லா வாயை திறந்து பேசுகிறதுக்கு இது பண்ணுங்கள். த மொமெண்ட் யூ ஓப்பன் யுவர் மவுத் உங்களுக்கு ஏர் ஃப்ளோ ரெசிஸ்டன்ஸ் கம்மியாகும், ஆட்டோமேட்டிக்காக வாய் வழியாக காற்று வரும், மூக்கு வழியாக வர்றது கம்மியாகும், அந்த நேசாலிட்டி பர்செப்ஷன் கொஞ்சம் கம்மியாகும். ஸோ ஒன்று ஓப்பன் மவுத் அப்ரோச் யூஸ் பண்ணுறது. இன்னொன்று நீங்கள் மானிட்டர் பண்ணிக்க வேண்டியது நீங்கள் பேசுகிற வேகம் எப்படி இருக்குது, அதாவது உங்களோட ரேட் ஆஃப் ஸ்பீச் எப்படி இருக்குது. ரொம்ப வேகமாக பேசுகிறீங்களா, ஒரு சிலருக்கு அதுவும் வந்து ஒரு தன்னறியாமல் பழகி போயிடும். ரொம்ப ஃபாஸ்ட்டாக பேசுகிறதுங்கிறது கொஞ்சம் பழகி போன விஷயமா இருக்கும். நிறுத்தி நிதானமாக, அதாவது நீங்கள் என்ன பேசணுங்கிறத முடிவு பண்ணிட்டீங்கன்னா அதுக்கப்புறம் நிறுத்தி நிதானமாக பேசுங்க. அதுலேயும் வந்து ஆட்டோமேட்டிக்காக நேசாலிட்டி பர்செப்ஷன் குறையும். நேசாலிட்டி பர்செப்ஷன் இருந்ததுன்னா குறையும். இந்த 2 விஷயங்கள் நீங்கள் ப்ராக்டிஸ் பண்ணிங்கன்னா அதுக்கப்புறம் கிராஜுவலாக நீங்கள் ஸ்ட்ரேஞ்சர்ஸ் கிட்ட பேசும்போதும் அதை பழக்கத்துக்கு கொண்டு வரது ஈஸியாக இருக்கும். ஸோ பட் அதை நீங்கள் பழக்கத்துக்கு கொண்டு வரணும்னா அதுக்கு முன்னாடி நிறைய ப்ராக்டிஸ் பண்ணணும். வீட்டில் உங்களுக்கு தெரிஞ்சவங்க கிட்ட பேசி ப்ராக்டிஸ் பண்ணுங்கள். ரீடிங் சத்தமாக படித்து ப்ராக்டிஸ் பண்ணுங்கள் இந்த டெக்னிக்ஸை யூஸ் பண்ணி. அப்படி பண்ணும்போது கிராஜுவலாக ஒரு பீரியட் ஆஃப் டைம் உங்களுக்கு அந்த நேசாலிட்டி குறையும்.
ஓகே, தேங்க்யூ.
So for those who need it in English, 2 strategies that I was talking about. One is use of an open mouth approach. Do not clench your mouth and speak. Don't try to have a clenched speech. Open your mouth nicely while you're speaking. That's one aspect that can help you improve your understandability. And the other thing is monitor your rate of speech. Make sure you're not speaking too fast. You can slow down and have clear pronunciation. That will help in improving the understandability.
Ashim, you have one more question.
Yeah, but I'm aware of the time's up.
But
I'll
yes,
keep
we
it-
can take a question. Yes,
Sure,
sure.
I'll keep it short. Ma'am, this is another question that has come up quite often in our community, which is when I'm speaking to you in person, your understanding of my speech would be better. But if I am talking on a phone call or if I'm recording an audio and playing it for myself, then the perception, what I understand about my speech, seems very different, as if they're 2 different people talking altogether. Why is this?
I think this is a phenomenon that we notice even otherwise, whether it is a person with cleft speaking or whether it is somebody without cleft who is speaking. The difference in a live voice versus a recorded voice is bound to be there. There will be changes. Like if I hear my own recorded voice, it does. The tone differs. There are a lot of factors that depends. The quality of the recording equipment, many of those factors determine how it is sounding. So it's very hard to very globally address this question. You need to see what is the difference that you're perceiving in the live voice versus the recorded voice. And accordingly, we will have to see what modifications you will have to do if there is a need for any. Sometimes it might not be the person's voice or speech at all. It might just be because of the quality of the recording equipment because of which those differences are perceived. Then you don't have to worry about it at all.
Okay, thank you.
Thank you. Ashim, you noted the time is up. So I hope with this session, the warriors have hit the ball rolling because everybody needs to ask questions. As I said when I opened, that no question is small, no question is big. Please ask questions because questions lead to information and information leads to transformation. And the transformation we saw the kids who performed here today. There's one more thing I just wanted to share with the platform over here that the other challenge that the kids who are born with cleft face is a lot of bullying. And Ashim and Sakshi, to tackle this, they came together and started what is called Seerath. And I would like now to invite them to just share what Seerath is and just tell us about it a little more.
Thank you, Renu. We'll take just 5 minutes to tell you about this community that Sakshi and I have been building. If I can request then, yes. So this is Seerat. This is made by Cleft Warriors, by me, Sakshi, and many other Cleft Warriors you see in the audience who are wearing a white Seerat t-shirt. For the reasons that we talked about, we don't have a surgeon or a doctor with us all the time. Growing up, we Cleft Warriors have realized that we need a community, we need more people, we need a support group to talk to. We need to just tell someone else that we're going through the same struggle and listen and get validated that yes, our silly struggles, our small struggles are valid. And for that reason, we made a community and it acts as a support group. And there are two parts of this community. One is a community for people who are born with cleft warriors, so many of us here. And the other is parents. And Sakshi will tell you a bit more about the journey and the inception.
Yes. So, everyone can hear me, right? Yes. How's the shoes, by the way? Hi? थोड़ा शोर से बोलो. Okay. So, thank you, Ashim. Now, moving on to how this actually started. So, let me take you through a little backstory. In 2022, Smile had organized their first ever cleft conference in India. And through that, somehow we realized that there is a need for a support community, as Ashim mentioned. And that is how we met, and it was just a group of 4 people in a WhatsApp group, which has grown to a community of 360 plus people at this point, from all across India. It's been, thank you so much, it's been more than 2 years now since we started this. We just started this with an idea of we just need a support community and we want to extend the support. And we didn't really think a lot about it, but one step at a time we started growing it further. We realized that okay, it's not just the Cleft Warriors that need the support, but it's also their parents and their family members, right? Now we are spread across India, over 45 plus cities, 360 plus members. We have multiple dedicated support groups and communities. And this is irrespective of any age, any gender, any social condition, what income backgrounds, nothing. We're all just united by Cleft under one platform. And the motivation has always been to make everyone feel like home, to make it a safe space, and nobody should feel alone. And nobody is tackling this alone. Okay, so we are here to support them. And yeah, that's how we started. And now we are legally registered into a not-for-profit organization. And we constantly look for support. And a lot of organizations, a lot of people came forward to support us. And Smile has been a very big support to us. So thank you so much, Smile India, for the platform. And in every way that we try to push us forward and contribute to Seerat and our initiatives. Moving on, we still look for help and support. If you can help us with grants, with funds, getting more people on board, helping us get more and more warriors into the community and family members as well. We also connect them with the right resources. We do a lot of online and offline workshops, events, catch-ups. He's very good with setting up picnics. So he has set up picnics in Delhi, Bangalore, Hyderabad, and we want to do more of it. We are very dedicated to this initiative, and we would really encourage all of you if you all can support this initiative. Thank you.
Thanks, Sakshi. While I am a self-decorated picnic master, but I think more importantly, from day one of Seerat, we felt that Smile Train India and our North Star alignment direction is the same. And that is why I'm very excited and happy to inform that Smile Train India and Seerat will, in the next few weeks, formally enter into a partnership where we will help each other, where we will support people with cleft and their families in terms of psychosocial support. We'll give them the right resources, give them the right guidance. But what excites me, Sakshi, and our team of Cleft Warriors like Seerath here and everyone else is that we've got a support of an organization which has been doing this for almost 25 years. So we're very excited to do this, to formally have Smile Clean India as a partner, and we look forward to it. And lastly, I think I just want to tell everyone about how to join Seerath.
So you can actually scan this QR code to join Seerath, and if you see anyone in the audience who's wearing a white t-shirt or Seerath t-shirt, please come and say hello to us. We would love to have a lovely chat with you. We can also catch up for a picnic. Just an idea. Okay. We will help translate this in Tamil. Also, I wanted to let you know that this is a very diverse and multilingual community. There is no language barrier or any other kind of barrier. Okay. So, if you come from any background, any language, irrespective, we are all united by Cleft. Please be a part of our community. We would love to have you on board.
ஷீரட்டில் நீங்கள் எப்படி ஜாயின் பண்ணுறதுன்னு அவங்க வந்து சொல்கிறாங்க. ஸ்க்ரீனில் தெரிகிற இந்த கியூஆர் கோடை வந்து ஸ்கேன் பண்ணிங்கன்னா உள்ளே போகும். அதில் வந்து ஹாய் ஹலோன்னு சாக்ஷிக்கும் ஆஷிம்க்கும் ஹலோன்னு நீங்கள் ஒரு மெசேஜ் பண்ணலாம். அதை பற்றி இன்னும் உங்களுக்கு தெரிஞ்சுக்கணுன்னா இந்த டிஷர்ட் ஷீரட் டிஷர்ட் போட்டிருக்கவங்க கிட்ட வந்து நீங்கள் வந்து கேட்கலாம்.
Thank you.
Thank you.
Thank you.
Thank you for this
Thank you,
opportunity.
everyone. Thank you. Thank you for a nice discussion.